the first two speakers certainly put this into a perspective that's really important. Donna Shalala's presentation gives us a real call to action. And thank you, Dr. Dye, for that summary preview, and gives us an impetus to work hard in making it the document that Donna Shalala is expecting of us. It's, every 20 years it happens whether you need it or not. Okay, you'll see I am Professor Emeritus, but my slides are from the University of North Carolina. We have moved back to Chapel Hill. I live in a CCRC. I used to be the director of a geriatric dentistry fellowship. I see a couple graduates in the room, and now I am a geriatric fellow. And the Gillings School, I have a unique relationship because Dennis Gillings was one of my co-authors, and some of the presentations we're making here today. There are 13 slides, and this is a consolidated summary. Stanley has heard this presentation about 9 times, so this is number 10, Stanley, okay?
It's moving along pretty good.
So, this is the outline. The outline, we will go through the co-authors, data sources, methods, results for operative dentistry, single tooth replacements, multiple missing tooth replacements, partially missing teeth, full edentulosum, and periodontal treatment. We then have a slide on whether we still believe this, what's the current validity, and can we convert need into demand, and we will make that into Marco's presentation. Here are the co-authors. There are 21 papers being summarized in 11 minutes here, okay? And those are the co-authors, mostly from the University of North Carolina and Harvard. So I'm giving attention to the fact that this is not an opinion piece. This is a summary of summaries of summaries. The data are from Haynes, mostly the health data from National Health and Nutrition Examination Survey. The population data are what we all use, Bureau of Census, population estimates. And we did get the CMS, John McKinley from New England Research Institute got CMS to give us a probability sample of elders, senior citizens, 65 and over, in New England. And so we have a probability sample of the 6 New England states, which also will present some findings. So here are the methods. In general, the methods boil down to what percent of the population in each age, gender, race, ethnicity group, and income group have whatever particular condition you're looking for, like operative caries. The C is caries. T is teeth. So teeth times caries times a half an hour, okay? Plus teeth filled times every 10 years. Now, it's true that a tooth with dental insurance has a shorter life expectancy, okay? Haven't figured that one out yet, but it's a fact. Times, and then you add that all up. For fixed and removable, we went with the prosthetics department's estimation of what you do for 2 missing teeth, 3 missing teeth, whether 2 on this side, 2 on that side, or whatever. We can argue about how to treat it and how much implants now might pay attention. Plus, then we also subtracted the annual supply from that, which is mostly done by general dentists. In full dentures, it's well known that for decades we've been declining in full dentures. But if you multiply the percentage decline in full dentures times the huge increase in population, particularly the older population. Bruce Dye just brought that to our attention. You don't even go down in full dentures, okay? And for periodontal treatment, we've estimated the number of people who have conservative periodontal, that is on a PI less than 2, and pocketing, that is a PI more than 2 in more than 1 teeth. Okay, so what did we find? Caries. This is in millions of hours of treatment need. In 1990, 14 million hours. In 2030, projected 35 million hours, okay? And you can, in the same, it kind of quadruples for the over 85 group. This assumes a decline in caries incidence, which has happened. In projected need for fixed and removables, it's hundreds of millions of hours. We are able, in the 5th column, the AS, to deliver 46, 47, and 49 million hours right now of prosthodontic services per year. You just subtract that from the enormous amount of unmet need of partially missing teeth, and you have a total unmet need, TUN, total unmet need, that's way above what you might be able to do. For prosthodontics, with the rates of edentulosum decreasing and the number of seniors increasing, what is the need for full dentures? And in this case, from decade to decade, we assumed a 10% decline in edentulosum. Okay, so that's in here already. And then we also took out, if you cover full dentures, 9 out of 10 people with edentulous people will use them. 1% or 10% will not. So we took 10% off. But in 1991 to 220, which is now, it goes up a tiny bit. Okay, it doesn't go down. What it does do is it is in the lower income population. My father was a dentist. He came out of a low-income family in Steelton, Pennsylvania, and he had full dentures. He was a dentist with full dentures, okay? Saved a lot of people's teeth in his lifetime. But it's now a condition that is more and more in the lower-income groups. And finally, the periodontal treatment need. We say in that paper, this was done by Gillings et al., okay? Consequently, the improvement in tooth retention coupled with the increasing number of older individuals has resulted in an actual rise in the number of elderly adults who have advanced periodontal disease. And these are our projections. There were 4 sets of projections these are people with pockets, okay, which would be your advanced treatment. Therefore, the older population need of professional periodontal therapy seems likely to increase. That was written 30 years ago, okay? And it has. Now let's see whether we still believe that, no matter what your assumptions are. By the way, that lowest assumption, which still goes up some, assumed that there was a decline. All of this thought that there would be a decline in the incidence of the disease. The current validity, the population trends for 65. Previous projected populations were slightly underestimated because what you have are birth rates, death rates, outmigration, and immigration. That determines the population. Now, for birth rates, even though there's a generation right now that's putting it off, most of us, all of us, who are going to be 65 or older next to their years are already alive, okay? So you don't have to worry about these guesses being wrong because the birth rate is going down. If you're interested in the next 30 years, we're here, okay? Okay. The death rates look like when you get to this age, there's a lot of activity and you're trying to put it off more than you ever put it off before. You didn't think about putting it off before, okay? But now you're putting it off. You know, we row. We're rowers, and we're rowing every day on San Francisco Bay, okay? Birth rates. The immigration is probably slightly underestimated, immigration, okay? So life expectancy is increasing. So we believe the population estimates that we used were correct or slightly conservative. The disease trends for 65 and over. I remember sitting in Chapel Hill 40 years ago, realizing that between 1974 and 1980, and this was my first paper, I said, there's 2 more teeth per person. And my son, who was 9, said, gosh, Dad, we're all going to end up, if we live long enough, to have about 40 or 50 teeth. So looking at caries and quoting Rozier, who quotes Dye, there's your caries rate from 1984 to 2004. It didn't go down in this age group, okay? What went down was DMFT from 19 to 17 or 18, and that's due to 1 fewer missing tooth, okay? One fewer missing tooth means 1 more tooth. But for caries, there was no trend. For periodontal disease, up to 2012, the prevalence is 46% for the periodontal disease, and for advanced periodontal disease, closing in on 10%. So we believe the estimates that we've made. Consequences of success. Anil Joshi in our department said, let's look at the senior citizens from the New England states. Do more teeth translate into more disease or utilization? So this is a probability sample of elders in New England. Have more periodontal disease. They do have more periodontal disease and more dental caries experience, and they visit the dentist more regularly. And I'll quote Bruce's, one of his last statements in the paper he had just published about tooth loss. With an aging population experiencing less edentulosum and greater tooth retention, older adults may need more regular oral health care and preventive services to address concerns such as root caries and periodontal disease. We believe we can give you, and that 2020 report, the data that makes that a solid statement. Conclusions. Unmet dental treatment needs are substantial and increasing, high and rising in the Medicare population. Periodontal treatment needs are significant, and you can, depending on what systemic condition you're talking to, you can say may be, do, appear to be, are related to hospital costs. You can go make that a lot stronger than it is. The number of elders is increasing. We hardly need to say that in this way. But you'd be surprised. I think that 20 years ago, it was apparent to me that the industry was the housing industry and the development industry. They figured it out early. And they're making a lot of money off of it. So the number of elders, it's just an overwhelming, I think Judy Jones called it a tsunami, okay? The burden of disease falls more heavily on lower income groups, okay? Which lots of us are coming to the conclusion, we can ignore that, but we can't, it's going to be hard to live your life without knowing that, okay? I asked CDC to give me one last estimate of periodontal disease. In an email 3 days ago from CDC, using the 2014 data, 68% of the people over 65 have chronic periodontitis. 57% non-severe, 11% severe, and 11% of an 80 million group of people is going to be millions and millions of people. Periodontal disease is up due to people up, teeth up, and the same thing is probably going to happen in oral cancer. If the rates of attacks stay the same and the number of people exposed to that increase, the amount that you have to deal with goes up. That's the take home. That's the take home, okay? If the rates stay the same and the number of people and teeth exposed to that condition increase, the actual number of cases increases. Okay, thank you.